The practice of cosmetic surgery has emerged as one of the fastest growing specialties in the field of medicine. And it's really not surprising considering the emphasis of youthful appearance in today's society, which encourages people of all ages to look at least as good, if not as young, as possible. And in this field, one of the most unique medical practices in the entire country can be found right here on the Upper East Side of Manhattan. It's called Plastic Surgery and Dermatology of NYC. And what sets it apart is the fact that it is the combined medical practice of a husband and wife team of physicians. The husband, Dr. Elie Levine, is a highly experienced plastic surgeon specializing in virtually every major cosmetic plastic surgery procedure, from facelifts and rhinoplasty to breast augmentation and liposuction, among others. His wife, Dr. Jody Levine, is trained in both pediatrics and dermatology, and is in fact the only pediatric dermatologic surgeon in private practice here in New York City. Her patients range from very young children to elderly adults. What would you say is the advantage of working with your husband and having a highly experienced plastic surgeon right here in the office?
First of all, I love working with Elie. He's smart, he's diligent, he's caring. I know that if he's going to advise something for my patients, it's what's in my patient's best interest. And I often call him in. Even if I'm pretty sure of my own idea, I like to hear his. It's great to be able to collaborate, and it gives my patients exactly what they need.
More often than not, Jody and I would find that patients would come to me or they'd come to her and they'd say, well, I want to have this done. And what we'd realize is that they don't need, maybe they need more, maybe they need less, and they really need a different person to take care of them. And so there would be people that would come in to see me for a surgical consult. They would come in for a facelift, and I'd look at them and they don't need a facelift. They may need Botox, or they may need resurfacing, and they were better served by a dermatologist. We come from different backgrounds in terms of training, so we bring different aspects to the mix, and more often than not we come up with a solution that we both think are the right solution that we may have come up with individually but may not have, and it's just an added benefit to have someone like Jody to work with.
I had been contemplating a facelift for many years. I didn't like the way my jowls were starting to descend and lines under my eyes, and I was in my late 40s at the time. And by the time I got into my early 50s, I had come across Dr. Levine through a lot of research and speaking to a lot of people, many referrals, a lot of consultations, and was very lucky to meet him because he understood exactly what I was looking for. I had upper and lower eyelids done, I had a brow lift and a facelift. I was very happy with it. The swelling was minimal. Took probably a couple weeks to go down, some black and blue, but it didn't impede me from eating on day 2 or really anything else. I had it done at the end of January a couple of years ago. My family knew, some friends knew, they loved it, they thought it was great. I've referred him to many people. People that I have told and they say I look well, I look rested, have you been on vacation, the typical platitudes, they don't believe I had a facelift. And I've even talked to other surgeons that I know who are friends of families and they don't believe it, so it covers everybody.
What's the process that happens here when a new patient comes in to see you? What do they go through?
I usually offer them Visia imaging, which is a computer system that takes a picture of their face and analyzes their face objectively as to where they stand in their age group. Where do they stand for wrinkles? Where do they stand for brown spots, red spots? The computer system can show you what you'll look like in 10 years if you don't intervene at all. And it's just an interesting objective tool that I use for interest. And also, in 6 months after I've treated the patient, we do it again so that they can see the difference in how much they've improved. I offer every new patient that I see, whether it's cosmetic or medical, a full skin check. I don't believe in giving Botox to somebody who could possibly have a melanoma on their arm that I haven't seen. And only after I've done my full skin check and know that they are medically healthy, then we address the cosmetic issues. These are the pictures you showed me.
Right.
And I see his lips are basically in even proportion, top to bottom.
Okay.
That's what you're looking for?
Yes.
Okay. So we will do that. And he also has a very prominent upper area. This is called the philtrum. 4 hours, I want the Botox to stay where I put it.
Okay.
I don't want it to go towards the eye. So we just did Botox to the glabella and the forehead. In men, the forehead is the most common area that I Botox. Men have very strong foreheads. big muscles, so they need a little bit more Botox than women. The crow's feet, we also treated, the lion smile Jason. Jason doesn't like those lines that come out from the sides of his eyes when he smiles. And we also treated the bunny lines. The bunny lines, I find, is the one area that most people forget about, and it's a telltale sign that you've had Botox.
More often than not, I'll be integrating brow or eyelid procedures with facial contouring. If someone comes in for a rhinoplasty, and they may be coming in because they're unhappy with some aspect of their nose, it may be a subtle thing, it may be something very significant, they may not pick up on the fact that they may have a small chin, and doing something for the chin, whether it's a small chin implant or doing something to the bony framework to improve the aesthetics of the chin, ultimately translates into nose looking better even before we've done anything to the nose. Body contouring has improved in leaps and bounds in recent years. There's so many more techniques for liposuction. I mean, there's tumescent liposuction, there's super wet, there's power assisted, there's ultrasonic, there's laser liposuction, more commonly known as smart lipo. And I integrate all of these things depending on what the patient needs in different parts of the body, in different skin types, and I think that's fundamental to it. And then another aspect that has really taken off is the post-weight loss patients, patients that have had bariatrics procedures. Those patients, after they've lost a lot of weight, benefit from, some of them benefit from facelifting procedures, breast work, whether it be lifts or implants or a combination of both, abdominal contouring, whether it's buttock and gluteal augmentation and lifting, or whether it's an abdominoplasty, and even in the thighs and legs. So there's so many exciting areas of plastic surgery out there that are all just fun to take care of patients with.
I had been living quite a few years with this extra stomach and gut. And I came in here like a bat out of hell a few years ago, and I said, Dr. Levine, I need help. He and my MD worked together, and I had a tummy tuck, and he made a brand new stomach. He took side fat off, the back fat, there's no more muffin top, and then I had some liposuction in my thighs.
I have several groups of patients. I have my pediatric patients, many of which have medical reasons to come. They've been sent by their pediatrician, some of which require surgery or laser. I have my teenagers, for whom acne is their biggest problem, and there are so many different ways to treat acne, so not everyone is getting the same treatment. And then I have my adults, most of whom are cosmetic. I definitely will treat them medically if needed, and my cosmetic patients will use me for their medical treatment as well, but when they're referred to me, it's usually for cosmetic reasons.
What originally brought me here was my daughter, who had perfectly clear skin and all of a sudden broke out all over her face, and I wanted to try and help her. I actually brought her to 2 different dermatologists before coming to Dr. Levine, and nobody seemed to be able to help her.
It was almost a little bit uncomfortable, like, you know, when you're speaking to someone and you think, oh, they're going to see like all the bumps on my forehead or all the scarring and the blemishes on my cheeks. And now that I, you know, don't have them anymore, it's like more of a confident feeling. But they were very helpful here. She took one look at my skin and she knew what to do, and she got me on a regimen. She got me the products that I needed, and everything just went really smoothly.
Dr. Levine assesses what your needs are, and they address the problems at hand. They also provide a lot of products that are excellent products. And I've been very disappointed in the past buying products that make claims and they don't live up to their claims. But Dr. Levine has her own set of products which I was extremely skeptical about, and when I started using them, they are fantastic products and they do what they say they're going to do. And they're much more worth the money than when you go to a makeup counter in a department store and you buy a cream that doesn't do what it says it's going to do.
Something that's very important to me is being patient with the patients. And when someone comes in for a consultation, I go through from start to finish, from before surgery to what's going on during surgery to what to expect after surgery. And I go through each and every one of those details. And so I really want them to understand what they're going through, because sometimes they're going through something small that doesn't have a lot of ramifications, and sometimes they're embarking on a real process. And I'm a firm believer that a happy patient heals better. So that if they know that I'm there with them, that if I'm holding their hand before they go into the operating room, when they wake up, that I'm there, that post-operatively I'm seeing them frequently and I'm seeing them, I'm taking off their bandages and changing their dressings and removing their stitches. I think that knowing that I'm there throughout the whole process translates into a happier patient and ultimately a better result.
The unique story of Dr. Elie Levine and Dr. Jody Levine and their unique medical practice, Plastic Surgery and Dermatology of NYC. I'm Doug Llewelyn reporting from New York.